Hey everyone, my name is Josh and I study blood flow restriction training. The goal of these videos is to make blood flow restriction training easy for you so you can better understand it and you can better apply it in practice. Now in this video I want to go over how to find a proper cuff pressure. Now remember, when we're doing blood flow restriction training, we're restricting blood flow into a working muscle. And what's doing the restriction is the application of some kind of cuff that gets inflated, puts pressure on the limb to decrease the amount of blood that can get into that working muscle. Now remember, we're only partially restricting blood flow when we do this. So the big question is, what is the cuff pressure that's required to restrict blood flow to the correct degree? Well, the correct cuff pressure is not going to be the same for everyone. It's actually going to be different for everyone. And why is that? Well, it's because the main reason is because people have different limb sizes. Right? People have larger limbs with lots of muscle, perhaps fat, or smaller limbs with less muscle and fat. So with different limb sizes, it's going to require different cuff pressures to restrict blood flow to the correct degree. Right? So what do? How do we find the correct cuff pressure in a person so that we can restrict blood flow to the correct degree? Well, what we need to do is we need to find a person's arterial occlusion pressure, also referred to as AOP. Now, what is AOP? Well, it's the pressure in the cuff that's needed to fully occlude blood flow or fully stop blood flow from getting into my arm or my limb. Now, we're not going to train at this pressure. We're going to train at a percentage of this. So how do you find a person's arterial occlusion pressure? Well, it's pretty straightforward. All you really need is a cuff that can inflate and the ability to find a distal pulse. Because what I'm going to do is I'm going to slowly inflate this cuff and I'm going to feel for my distal pulse. And when this distal pulse disappears, I know the pressure in the cuff is enough to fully stop blood flow. And that pressure in the cuff when my distal pulse disappears is my arterial occlusion pressure. Now again, we're not going to train at this, we're going to train at a percentage of this. And research has shown that if I train at 40 to 80% of my arterial occlusion pressure, that's going to be effective for increasing my muscle size and muscle strength. So let's go over an example here. Let's say I want to do some blood flow restriction bicep curls. I got to figure out what pressure in the cuff I need. Well, the first thing I need to do is measure arterial occlusion pressure. So I'm slowly going to inflate the cuff until my distal pulse disappears. The point at which my distal pulse disappears, I know the pressure in the cuff is my arterial occlusion pressure. I'm not going to train at this, but let's say I want to train at 80% of my arterial occlusion pressure. Well, let's say I measured my AOP to be 100 millimeters of mercury, right? 100 millimeters of mercury was enough to fully occlude blood flow from entering my limb. But I want to train at 80% of this. So I'm going to, when I do want to do my bicep curls, I'm going to inflate the cuff to 80 millimeters of mercury and do my training. So that's how you find a person's proper cuff pressure. It's not the same for everyone. It's going to be individualized. And the first thing that you need to do is find arterial occlusion pressure. And after you do that, you can train at a percentage of that, either from 40% to 80%. And that's going to be effective for increasing muscle size and muscle strength.